Hi, my name is Noah Purow.
And my name is Dr. David Purow. I'm a gastroenterologist and hepatologist who's been practicing for 15 years.
Today I'm going to be interviewing Dr. Purow about alcoholic cirrhosis. What do you feel like when you're about to perform an endoscopy?
When I'm about to perform an endoscopy, I have a mixture of excitement and a little bit of nervousness, much like you might feel when you're about to come up to plate in a softball game where the ball is kicked to you on a soccer field.
Okay. Are you ever worried that these procedures will fail?
Yes, but you have to go into each procedure knowing that you're going to do a good job. And unfortunately, we are not perfect, so sometimes we fail. So I don't worry about it, and if it happens, you try to learn from your mistakes, if there were any. Because if one fails, you gotta be ready to do the next one.
Okay. Why do you do what you do? Like, why did you decide to become a doctor?
There's a lot of reasons that I wanted to become a doctor. I like helping people, and I think a lot of the things that we get to do are very interesting, and it's a lot of fun.
How are you sure that the treatments or medications that you're giving your patients are safe?
That's a very, very good question. Before any medication is allowed to be given or prescribed by a doctor to a patient, it has to be approved by the FDA, which is the Federal Drug Administration. And before it even comes up for approval, there are many studies, which include usually hundreds or even thousands of patients, to make sure it's safe. If when they're testing a medication that people have too many bad side effects or problems, then it won't get approved and you can't prescribe it.
Okay. And finally, were there ever any endoscopies that you specifically remember?
Yes, there have been a lot of endoscopies that I specifically remember. One was endoscopy I had performed on myself, and I had a piece of steak that got lodged in my esophagus, and my friend had to perform an endoscopy to push the steak out of my esophagus into my stomach where I could digest it.
Mm-hmm.
And some of my favorite, most rewarding endoscopies are when we stop bleeding in varices from alcoholic cirrhotics, where you come in and there's blood everywhere, and you put some rubber bands on some varices, and there's no more blood. It's very rewarding.
Cool. Okay, so I think that's pretty much it. Thank you for answering my questions.
Thank you very much for asking the questions.
Okay.